everything. We are so happy to be here. My name is Letitia. I'm a women's health provider. I do women's health. Um, I want everyone to introduce themselves. I'm a married woman. I have 2 babies, beautiful boys, handsome boys. So I want everyone to introduce themselves. Yeah, it's done.
Hi guys, my name is Leah Serenjoji. I recently graduated medical school in last May, so I'm currently in residency. I'm a resident of medicine and psychiatry, so yeah, I'm not married, no kids.
Hello, praise God, everyone. My name is Lilia Magoba. I'm an adult geriatric nurse practitioner. I'm married to one notorious shy Will. And we have been blessed with 3 children.
Hi, everybody. My name is Lillian Lawanga, and I am a dentist. I graduated from Tufts, and I'm engaged and have one boy. He just turned 1 year old. So,
Congratulations. Congratulations, Lillian. So I'm so happy to meet all of you. And one thing I've learned is the importance of connecting with people, because you never know who you will need. It doesn't matter the age, but it's important for us as women, as men, to connect with people. So I'm really excited to connect with you guys. And if any of you has a question, a private question, feel free to reach out to them. Most of these people here have practices. Feel free to reach out to them, work with them, and I always say get help, right? So today, really the focus of the conference is about mental health. With everything that has been said, was said yesterday in the morning, I just want us to talk about mental health and how we as women and in our professionals, how we handle mental health. Have we ever come across situations where you felt like you were mentally challenged, and how did you overcome that? I want people to understand that even professionals seek help, right? So yeah, if you can just talk about that.
I think what I can start by saying we do have a primary care practice in Waltham. We do a lot of screenings for various conditions or issues that can be misdiagnosed with mental health, such as electrolyte imbalances, thyroid conditions, anemia, etc. So we do a lot of screenings, and when we do find that someone screens positive, we refer to the specialist to get the expertise and to get appropriate treatment for the various patients.
Okay. Did you guys get what she said? Does anyone have any questions about that? Because it's really important what she mentioned, that not everyone has mental health, but you can have an underlying condition that could mimic, could trigger mental health, right? Yeah. So does anyone have any questions? One question.
First of all, we are proud of the doctors who are black and our Christian. We just want to take this honor to thank you. Please thank you for studying and graduating, not even halfway. And another thing, we are so proud to have doctors whom you can go and explain in your own language. That's also very tough. People face the doctors and they ask them the language, some accent are not understandable, but you can approach them without fear, and she'll ask you, ogamba ki, kiki ekikuluma, wa wakuli obubi, kiki ekikusimbye, which you cannot explain sometimes when you meet. Yeah, when we just came here, those are the problem we made. But if God has risen such people, our children, to be our doctors, you enter with comfortable, You approach them with comfortable, you have no fear, and she even give you courage. Don't worry. I'll tell you, I'll do. Even our grandmother, when they come, I think one. But we have one question especially for Dr. Lugo. Nze mmanyi lya mwami. Lwaki omuyita lirya magoba? Gwe mwami. Eno bajja kutwalako omukyala. What I want to ask, I'm Pastor Samuel Kasozi, that's why I started, because we have many people comes, and we are we're concerned. We just want to know where your medical clinic, is it a facility, is it a hospital, is it a walk-in, what is it? And also the address. Please specify your address so that we can also address our people. It is very important. We have visitors who come without medical insurance. We need to know if they can come and be checked, because we have many people come from Africa. They have never even faced a doctor for that. Yes, for checkup, for when we go for review. A yearly what? There is what they call a yearly what? Exam, yeah, physical. They have never been there. In Uganda, they just eat, and before you know, they are falling down. So when they come, we want to advise them. We can even pay for them. So please, at least clarify about that, and then we shall be good.
Thank you. Thank you, Pastor Kasozi. So location, we are located in Waltham, 24 Crescent Street. It's the building next to Mr. Mutiaba Oba Karibu, Oba Chiaga, the building where many tax professionals are located. What services do? We do adult primary care services. It's a health clinic. So just as you go to your doctors for sick visits, for annual physicals, screenings, we do have a practice where you do come in, we take your information, we refer you for blood checkup to the labs, or refer you for screenings. We do take insurances, but we also do see patients who don't have insurance. So we see everyone. And if someone has a complex condition, we might recommend to go to the emergency room or ways on how to get insurance.
Yeah. Amazing. And, just to add on that, sort of promo, I've been there, and I actually was sharing with her when I was there that I like the fact that she actually does what has to be done, right? Because some doctors, when you go there, because they have so many people, I would say so many people, and they want to, meet as many people as they want, they don't tend to do certain things that are really important, because diagnoses are found once someone does something. So she sort of did everything, and she, checked me out on everything, and I was appreciative. So please, if you think your doctor is not doing a good job, try your own, right? Yeah,
Thank you.
own. Yes, try your own. So, yeah, back to the question that I was talking, we're sort of tackling. How are we dealing with mental health as in our professions? How are you dealing with mental health, Lillian?
For me, I think it's more of the support system, the people that you have around you. It's a given. Everybody goes through hard times. There are days that you just need to call to somebody just to help. So I think having a very strong foundation, a support system, and faith is actually really important. And don't be afraid to reach out if you need help. Most people tend to stay in, they're like, I don't want people to know, or I don't want to deal with this, somebody's gonna say this. You come first, your health comes first, and you cannot help other people if you're not in good state. So I wholeheartedly believe reaching out if you have to. There are professionals everywhere, and also having a very strong foundation and support system. I think it's important.
Amazing. Thank you. So the other question I wanted to, ask, and it's around the same question, and it's really directed to Leah. She's a young girl. I'm older than her, but I want to know how she manages all this, big things, residency, school, and she is a minister. She ministers as a youth, and I believe a leader, because so many people look up to her. I'm older than her, but I look up to her too, because there's things she has done that I think not everyone will be able to meet. So how do you deal with that aspect of mental health? And your friends are going out, you have to study. How do you deal with that?
I think for me, like growing up, I've always had the dream of being a doctor. So having that idea in my mind made me to block out all the, what would I call it? The distractions, yeah. Block out the distractions. So if I have friends that are going out, I'm looking towards my goal of, I have this exam, I have this goal of being a doctor, I have this goal of helping people in medicine. So I think for me, that's what kept me going, because I've always had this in my mind. No one forced me to go to medical school. It was my own desire. And how do I deal with mental health?
Have you had a scenario where you had to, seek help, stuff like that?
How I deal with mental health, honestly, I would say on top of the support system, I would say God is like on, the top. Going through medical school, residency, you're gonna, be depressed. It's not easy, but praying, my mom can tell you she prayed with me so many times, and I cried so many times with her, but, having the support of God and reading the word, and yeah, I would say that.
Amazing. Thank you so much. And so the other question I want to pose to us: how are we using our careers to help other people? How are we impacting, and sort of, because like you see us, we are only 4 people here, but so many people can be on this side, and we can do so many conferences where today we are speaking, tomorrow is someone else. So how are we, putting that in mind of helping other people, and just pushing other people forward, so that where we have run, other people can really walk?
I can start. I would say that how am I using my experience and career, other people, in mental health or generally?
Generally, it can be mental health.
Mental health, I would say I encourage people to get help. Get help from your pastor. Go to Pastor Kususi. He can pray with you. And it's also okay to go get help from, counselor or your doctor. There's so many, as they say, so many conditions that can trigger someone to not be mentally okay. Medical conditions, even medications like steroids can trigger someone to have hallucinations. And so if you started a medication and you feel like you're not okay mentally, it's okay to talk to your doctor and see if maybe they can change that. And if it's something that requires like a psychiatry, it's okay to get help. I want our community to get away from the stigma surrounding mental health. Yeah, it's okay to get help. That's what I would say.
Okay, one more time. So how are you using your profession to help other people?
So how am I use my profession to help other people? So that was actually the genesis of the practice. For so long, we were doing inpatient. We have a lot of our own people who were coming to the inpatient at late stages of the diseases. Either they come when the diabetes is advanced or the high blood pressure is advanced. So we, myself and my husband, we felt we had to do something. First, the opening of the clinic, and what we noticed, some of our people, they call back home and they seek medications, and they don't know what medications they're taking for. Your renal functions can be impaired, but they are seeking help. So our reaching out, opening up this clinic is hope that people can come and get checked and know what is in the system. As Dr. Clark mentioned, our people perish for lack of knowledge. So we will perish if we don't know what is within our system. So the knowledge that we have, we share and have our people come to us and get the information.
Hello. And to piggyback of what she's saying, I believe education and knowing what's important is absolutely crucial. So a lot of people, like I'm a dentist, so a lot of people are like, I'm not gonna go see a dentist until my tooth is not hurting. Nothing in my mouth is hurting. Not realizing that it's not supposed to hurt. So if it hurts, you're at the end stage of it. If you actually keep up with your appointments and go see a dentist, I always try to compare it to, let's say, cancer. It's gonna sound terrible, but hear me out. So if you go see a doctor and you have stage 4 cancer, the prognosis is a lot different than if you had stage 1 cancer, correct? So same thing with dentistry. If your tooth is not hurting and you just go for a regular exam and they tell you that you have a cavity, please, please, please take care of that cavity because it's not gonna go away. It's just only gonna get bigger and bigger and worse. So if you don't take care of it and then it starts hurting, at that point you're looking at, let's say, equivalent of stage 3, stage 4, because then you're dealing with things like you have to take it out, or it's gonna cost you a whole lot more to take care of it. Then you're running into other problems of, okay, just take the tooth out. I'm not gonna go into all of that. But the point that I'm trying to say is educating people and letting them know, stay on top of your appointments. It's not just your mouth. Your mouth is connected to your whole body. So the bacteria in your mouth, the blood in your mouth, everything circulates throughout your whole body. So we have conditions like bacterial endocarditis, and that's when literally bacteria from your mouth travels to your heart. So, and then another example is, I don't know if you guys know, but before you get major surgeries like heart surgery or knee replacements, you actually need a dental clearance. That's saying that you have good oral health, because you could run into other problems. And unfortunately, I've had to say, I can't give you clearance for that heart surgery because you need to take care of all these things. So to bring it back is just make sure you don't neglect this. So I try to tell people this and let them know. I'm not trying to scare anybody, but it's absolutely important. It's not just teeth. They're connected to your whole body. So if you could take away something, take that.
Yeah, and that's really important, just to, add on what she said. As a women's health provider, one thing we ask people when they come in when they're pregnant is about their dental health. It sounds far-fetched, but it's really important because, bad dental care is tied to premature births. And it looks far-fetched, but this body is really holistic, that one thing can really affect the other. Okay, so it's really important to keep up with your appointments, right? We are busy with work, but you can be stopped from working because you're not healthy. It's so funny, but that's the truth, right? So everything is connected. You may be like, oh, how is that helpful? But it's really, really helpful. I have a hand there. Yeah, we are gonna direct. Yeah, can anyone share about that? I don't know how to help with that. You want to share, Leah?
I think just encouraging them to get help, because when you go to your primary care doctor, they're gonna do all the screenings of like prostate cancer and different things. So just encourage them that when they see their doctors, they can maybe prevent life-threatening conditions that could save their lives.
Yeah. Do you have something to add, Leah?
I think what I might add to what my panelist mentioned, I think we need more talks to provide more information. So we need another Men of Purpose conference so that we can share the importance of this and get more men involved on the provider side. So that's.
Yeah. Lillian, you have something to say about that?
There is a doctor out there that we missed, and I apologize. So can the doctor Emusu say something, please? Yeah, he can.
What? We need the men to say something. Definitely, doctor, come and join us, please.
Yeah, you can say something there or join us. Can I take the mic?
God bless you abundantly, Dr. Musu Donath, a doctor by training, a doctor by trade. Much older than everybody around here, anyway. Don't worry about that. Two questions. One to the women's health specialist. We have heard a lot about postpartum psychosis. It is something that is coming up. Very many mornings when I'm driving and I'm listening to NPR radio, rarely do I miss them discussing that. Now the question is, what are the risk factors? Exactly what is this, animal called postpartum psychosis? What are the risk factors? And when it comes to racial inequity, how do we stand? How is it distributed, along racial lines? We as black people, where do we stand? And I've already said risk factors, and how would you advise our women, to prevent this? I don't want to ask about treatment about this, but prevention will do. Secondly, I was just thinking that, some simple epidemiology of, mental health, that is the prevalence in our setting here, the distribution maybe along gender lines or racial lines, I think would benefit very many people. I remember those days when I used to sit in those cold lecture theater and they would teach me those things like epidemiology. Oh my goodness, I would be scratching my head. I said, oh, so this is what they mean by epidemiology. It's the distribution and frequency of disease in human population. Thank you. Let me not talk too much. Thank you.
Yes, thank you so much, doctor. So what can I say about, postpartum depression? It's, of course, depression, and it's real. People tend to think, maybe people are pretending, women are seeking, attention, but it's actually real, because think about it, right? As women, during our periods, when you're having your menstruation periods, you see how some people have anxiety, some people have cravings. Your hormones tend to change so drastically, and they push you to do certain things that you do not want to do. So sometimes if you don't seek help, if you're not on medication during that period, because some people are put on medication just to sort of be able to, get through that period of menstruation. If you do not have that sort of help with the medication or therapy, you can go overboard, right? So we are talking about menstruation. But now, if you turn it to pregnancy, where everything is over the roof, all the hormones are up there, then it's much worse. Because as a pregnant woman, when you're pregnant, right? After pregnancy, you had all these hormones happening, right? And then the baby just comes out, boom. And then these hormones have to have a balance. And by the time some people can control it, some people can control it. It depends on how strong you are, I think. But it's real, and if you don't seek help. And normally when when you get pregnant and you give birth, that postpartum period, they ask you to see to go back for checking and on all that. They tend to do screening to make sure you're fine, right? They tend to do screening. Are you over crying? Are do you feel like you don't, do you feel like you want to hurt your baby? Do you feel like you don't want to, do some activities the way you used to do them? All that is screening, and it's really important. Yes, we want to go back to our jobs after giving birth, but you need to reach out for care because it's really important. There's not much I can say. Truthfully, I don't have, the statistics like, Dr. Emus was asking, if you see those changes, because they will not realize the changes themselves. And like the lady said, Lilia, yes. Like she said, screening is really important. And as a women health provider, that's all I can say. You have to go screening. That's the only, yeah. That's the scale that she's talking about. You have to go get that screening done so that you can have a diagnosis put in place. Otherwise, that's, Viola has a question. I don't know if there's anyone who wants
So
to
what I was going to add, prevention. Being in primary care, I always advocate for prevention. Back home, when you give birth, usually they send someone from the village or one of your relatives will come and stay with you for a month or 2 or 3. Unfortunately, that's not the case here. We all have to work. So what I would say, just having a support system, it's within church, checking on our own people, once after someone has delivered, to go in and check on them, help them watch the baby while they get some rest, because it takes something small to trigger you off to the other end. So yeah. Prevention and just providing that support system so that we don't fall to the other end.
And just to add to that before I get the hand, something that is on my heart is really teenage pregnancy. Because you have no idea how we can push someone to a limit that they can't handle if we ourselves, people who are supposed to help, are criticizing. I can say something small. So, first of all, is if someone does something that is out of the ordinary, right? They are oversleeping, some people overeat. If someone does something that is out of the ordinary, they cry, they are crying so much, they are sort of isolating. All those things tend to be can be attached to. I don't know about men having postpartum depression, but maybe someone can. Yeah, I've not.
I had never heard of it.
I mean, they can get stressed about the pregnancy, but yes, yes. If
Praise the Lord. I think I've seen having a church, and I've seen different people having different reactions. For the side of men, actually, what happens is once, especially the ones that are getting the firstborn, because much attention is put on the baby, that is the time when the baby is born, or maybe even before then. The wife probably is now like in a moment whereby you feel tired all the time, and much of the attention is on the pregnancy, and poor husband who has been receiving full attention now it's now being put on the pregnancy. So this is where the issue is. And also when the baby is born, much of the attention is put on the baby, and they feel left alone. So especially the people who are getting the firstborn. So they feel left alone, they feel kind of left out, they are kind of neglected. That's how they feel, but of course we've had all these counsels, like we do counsel people through these kind of situations. So this is whereby men also, I think, they need their kind of maybe kind of support so that they can actually be told that this is a moment where two of you have to put your effort and your help together to help this baby grow. Because, but they have to be told also, they need help too. They need that support because they're experiencing something that is really new. They don't know about it. Just like a young girl or a young lady who is giving birth for the first time, you don't know what's going on. Even the husband who is also getting a firstborn, he doesn't know how the reaction, so many things. They get frustrated. They feel like some of them actually, someone who has been coming back home early, they start to come back home late. Even the moment when the baby is crying all night. So these are moments when also they get frustrated. This is a different atmosphere. They don't know about all this. So these teachings actually should go both ways, to the ladies and also to the husbands. So both of them actually, they need help. Thanks so much.
Thank you so much. I wanted Leah to, before we go back to what Mama was talking about, Leah, I want you to talk about some of the signs of depression that people can watch out for. Yeah.
Some of the signs of depression, well, suicide thoughts, homicide thoughts, changing appetite. It could be increased or decreased appetite. Sleeping more, or even sleeping less, like waking up and not being able to fall, back to sleep. Trying to remember.
So there's screenings. Thank God for this generation we're in. It's an industrial or informational age where there's so much information online. There's screening tools that you could go online. Usually we ask in the last 14 days, have you had any changes in appetite, eating too much or too little? Have you had thoughts of hurting yourself or others? Do you feel embarrassed? Or do you feel like you've let yourself down? But to preface what Mama said before, being that many of us belong to a community, before someone gets married, there's premarital counseling. So I think we need to also emphasizing on having like a family planning, so that parents can know, especially new parents, can know what they're getting themselves into. Yeah. So to prevent the shock and the depression. So we should be more preventative versus reactionary after the fact.
I don't know if Lillian, you have something to add to that, to depression that men have with.
I think they did a really good job, kind of like summarizing and telling the details that go into it. I also think it's very individualized. Like everybody's different, right? My depression may be different from hers. So just knowing your partner, I guess, and just seeing that things are different, or something's different, even if it means just having a conversation, be like, okay, this changed, what's going on? I feel like something's off, you never did this before, what's going on? The open dialogue and conversation, so that people are not just going through it by themselves. So, because depression is different in everybody. So I think open conversation also can help.
Thank you so much, Pastor. Pastor had a question.
I'm Louis Mbaz Geoffrey. married to Josephine. Mine's about two areas. One of the areas Dr. Musu has mentioned it. It's about our color. Dr. Her name I didn't get. I said she needs to help our people and whatever. Dr. Clark. The moment she mentioned that we need to come in and support our people, to help our people, it means that we are clustered. There is certain things which are akin to people of our color. And personally, as a person from Africa, Uganda, lately we lost somebody, and as we go through a process of grief, it is mentally challenging. And this is what I discovered as I shared with the other people. Somebody told me something, maybe you'll confirm, but this was his analysis. He told me that people from Africa, when we come here, in particular, I was talking about the Ugandan community. When they reach in their 60s, they are extremely old. They are senile. That's what he told me. He said that the people we have buried and who have died, the burials he has attended, most people who die, I'm talking about death. I'm not talking about the living. The people who have died and they have been repatriated and sometimes even buried here, normally the age range, all of them are in their 60s or late 60s. And he said, how come in Africa or in Uganda, there are people who are strong at that age, and when they're here where there are facilities, people tend to die off. And he said that it seems there is something that happens to our bodies when we come here. So the professionals who literally see these people, I think they can help us more with this analysis and get to know that I'm not condemning you when you're about that age. Neither am I saying that when you're 60, you die off. But it seems also lately, somebody also told me that every one of us here who is in this region is normally vitamin D deficient. And it has issues it brings to our bodies. And we tend not to mind about vitamin D because we normally got it naturally. And eventually that one, our bodies tend to get issues. And finally, maybe the way we eat also matters. And we end up not functioning mentally well. Now, you as a team, can you tell us how we can go through this challenging, grieving period? Because in Africa, we had a support system. People knew how to handle grief. Even those who have not gone to school. They're always around you and finally you overcome. But when you are here, it becomes extremely challenging. In this new setting, how do we overcome it and how do we go through it?
Thank you so much. I think Dr. Leila mentioned something about, the importance of screening and how so many, sorry?
I think she means like grieving.
Yes, grieving, and I wanted to bring the other part of vitamin D deficiency.
At that point, then you'll feel good about yourself. If you look at yourself in the mirror and you're happy with what you see back, then that's kind of like vibrated throughout the rest of your life.
I just have a question before we move on to the next. Honestly, in this room, how many of you have had your annual physicals? Just being honest. Okay. Well, that's great. Because many of the conditions as...
Not so many
I don't
men.
see as many men, but we hope that will change. Thank you. As I emphasize a lot of primary care and screenings and preventative care, because when someone, Mr. Luimbazi mentioned that the life expectancy of us immigrants is much lower than the general population. And why is that? What I can say is lack of seeking preventative services. As Dr. Lillian mentioned, the teeth, if it's not fixed, guess what? It's going to get worse. And also conditions such as diabetes. When you show up to the doctor's office and they say you have diabetes, that condition did not start that day. 10 years ago, it's been creeping up on you. So if you have been seeking preventative services, they could have caught it and recommended lifestyle. And the more you know, the more you're gonna need, you seek changes. So what I might emphasize to each and every one of us is to seek preventative services and go in annually for your checks, just as you take your cars every year for check-ins. Our bodies are our engines that carry us forward, so we really need to do better with that to adjust so that those numbers can be adjusted.
Yeah, I was gonna add something in terms of immigrants. I feel like, you know, we work so hard to, you know, support our kids and families back home that sometimes we forget to take care of ourselves. But, you know, if you don't take care of yourself, then you won't be, you know, you won't be here to look after your family and see your, you know, your grandkids and your great-grandkids. So just try and find time in your busy schedule to, you know, live a healthy lifestyle, go to your primary care doctor and get a health screening. It's gonna take like 20, 30 minutes of your day, but it could help, you know, if you have diabetes, they can set you on medications that could, you know, help your health overall, yeah.
So nothing works unless we are working, right? The job that we're trying to go to, the house that we're building, the money that we're saving, all of that doesn't really matter if we're not here to enjoy it or to see it. So you have to take care of yourself every day. And just remember, you come first above it all, because nothing works without you. And the thing that I do want to add on is actually a lot of diseases can be detected in your mouth first. So yes, go see your dentist, everyone.
Amazing, I like that. We have one more question, and then I'll ask the panelists to, you know, just say a word. So what? If you have a-
One thing, maybe they have already covered this. When you have a mental problem, you will not know. You either deny or you're going to be the last person to know that you have a mental problem. So with our community, the Ugandan community, please be attached to somewhere. You will go to the doctors, you will go for your physicals, they will check you out. Where do you pray from? We're going to ask Asabira Muchachichi. Who knows her? Who knows him? Who is your friend? Bino betugamba nti bahanze bannayuganda bantama, please, we need each other. That's how we're going to help each other. The people around you are going to be the first people to realize you're not doing good, and they're going to help you, and they look for assistance. And they're the people you're going to trust in, and you're going to believe in what they tell you. Even if the doctors tell you something, you're not going to believe. But the people you live with, the people you pray with, the people you laugh with, please have a social connection somewhere. Be somewhere attached to someone. Thank you.
Thank you so much. All right, so our time is up. I just want everyone to say, in a second, just, you know, say something to the people. What do you want to say? Anything in just a second.
In just a second, what I can say, so like I mentioned initially, we do have a primary care office. You can call us at 781-358-8633. We can help you. And the last thing I can say, even if you don't come to us, go get yourself checked. Preventative care saves lives, and that's no lie. 781-863-3533, and we are located in Waltham, Massachusetts. The practice is Socorro Primary Care. You will see, we will share on various platforms, so there will be posters in your various church groups. And if you do not, either myself or my husband can wave, you can approach either one of us and we'll be able to assist you.
Thank you so much. Do you have something to say? Or Lillian, whoever.
Closing words, I would say, since this is a mental health conference, I would say if you feel like you're not yourself and something is off, it's okay to get help. And, we should try and get away from the stigma of, like, when you think of mental health, you're thinking of, mental health encompasses so many things like anxiety, depression. So there's so many things that could trigger, that could be treated, like she said, electrolyte abnormalities, medications, and so it's okay to get help.
And to tie it on with mental health, a lot of people are scared to see a dentist, but the reason, okay, nobody asked. How what? How many people this year have seen a dentist? That is terrible. Okay, so I understand a lot of people are scared to come see us, but that fear comes from people waiting till it hurts. So you come to us in your worst possible state, right? Think you've not slept, you're angry, they're telling you have to take your tooth out, it hurts. So if you come and you actually stay with maintenance, trust me, I've worked in a lot of offices where, let's say private offices, people come there, they love coming to see us. They get their teeth cleaned, they get whitened, but if you come because you've been in pain for days, there's no way you're gonna be happy with me regardless of what I tell you. So don't wait until it hurts. Come see, a cavity is not supposed to hurt, so come see us sooner. And don't be scared, I promise we love you guys.
Thank you. I have a question there. Just one question. This is my mother. I can't say no. So be nice, people.
Praise God, everybody. My name's Shifa Lilian Nakai Chivira. And I don't know whether I got you wrongly. Your advice. You've been talking about mental health and others, but to me, I got it like you were talking about adults only. I'm a radio presenter, a senior radio presenter who has worked in media for over 30 years. But I have a feeling that you should mention about children or kids, because at times, according to the experience I have, our children start from when they are still babies or very young. They start having that mental problem, and the parents can think that maybe they are just stubborn, they are just, they don't want to listen. but in the actual fact, they have a problem. And before you know it, it grows with them. By the time they become teenagers, that's when you start sensing and realizing that maybe there is a problem somewhere. But it started long, long back when the baby, when it was still a baby, and now it has maybe, it has gone too far, and they end up going to Butabika and other hospitals. Can I ask you, please, to tackle that part a bit, though the time seems to be not on our side. Thank you for listening.
Thank you so much. In a second, I don't know if, Leila, you can answer that.
So,
Leah.
Our president, Dorothy Sevaka, did mention there was a discussion this morning about children, adults, etc. But what I can say is it starts with us. Because if your mental well-being is not okay, then you cannot recognize what's happening to your little one. So it starts with us, but there's more dialogue on this topic since we're running out of time tomorrow at 3 o'clock. But also there's helpline 988. If any one of us loved one is experiencing a mental crisis, they can call 988 and someone on the other line will be able to assist, direct you to the appropriate professionals.
Thank you so much. Let us, give a vote of thanks to our panelists. Okay? Thank you so much, ladies.